today there's such a carryover or blending of the two positions that an HR manager needs to know what's going on from a safety perspective. And for smaller businesses, the safety perspective, I mean, they're not you're not large enough if you're a small business to have a separate or another individual to handle those responsibilities. So I'm going to talk about safety issues. I'm going to touch a little bit on returning employees to work, some of the considerations there. And I'm going to talk about furloughed employees. I'm going to talk about laid off employees. I'm going to talk about employees who have been terminated and what's the best practices for returning them to work. I'm going to talk about safety issues as far as things that you need to take into consideration with respect to the workplace. And it's not only protecting employees, but it's protecting your assets, because there's certain minimum things that you are expected to do, and you need to do them to be in the best position possible to defend against a potential lawsuit from an employee or a visitor, customer, or something along those lines. Now, at the end of the presentation, I'm going to provide you some links to websites that can provide you more in-depth information, maybe more specific information to your particular situation. But I'm also going to provide you a link to our website, Fisher & Phillips website. We have received all kinds of awards for the information that we have put together with regard to COVID-19. And one of the most valuable pieces of information on our website is a frequently asked questions section. As of a couple days ago, it was about 81 pages of questions that we've received from clients and have responded to them. It covers array of topics such as immigration, safety, HR, wage and hour, benefits. It covers everything that you may want to know, and you can submit questions. There's also you can subscribe to our alerts. As developments occur across the country, we are issuing alerts. Now, we have offices, I think about 38 offices across the country now, and we are seeing what is going on in other jurisdictions that can have a potential impact on Georgia, or potentially on Georgia in the future. In that regard, we're seeing a lot of litigation-related activities in California, which could be a precursor to what we see coming across the country. So be aware of that. And again, if you can't find the answer from some other source, you can email me or call me. A lot of people call me. I've done 2 previous webinars on other COVID-19 topics for the chamber, and thereafter I received a lot of calls and emails about specific situations that existed within the company. So without further ado, let's get started. Okay, I want to start off by talking about sort of the baseline. This is the Opening Up in America Again plan. This is not a law. This was on April 16th. The federal government issued this informational thing for everyone, and they broke it down into 3 phases. Now, this is sort of bedrock. You need to understand what's going on, because it's all these orders, local and state, shelter-in-place orders and reopening orders sort of take this into consideration. So with phase 1, employees are recommended, now again, this is not the law, are recommended to do the following. Step 1 is to encourage remote work and telework. Now, we're kind of in phase 1 right now, okay? Because and you'll see this going through, is we may be between phase 1 and phase 2, but we're sort of sitting in phase 1, and it's because you hear a lot of talk about we're going to have another spike. But you know, there's information on both sides, people arguing opinions on both sides in that regard. Okay, but step 2, is it possible return employees to work in phases? You know, it may be difficult for a company to return all the employees at once. Okay, it may be easier to handle. Specifically, it may be easier for employers to bring back employees in phases to determine what the issues are going to be. Deal with the issues on a smaller scale before you bring everybody back. Step 3 in phase 1 is to close common areas. This is a big deal. Where personnel are likely to congregate or interact, and it talks about social distancing or spatial distancing. This is a bigger problem than most employers realize. And I'll talk more about this as we go through the presentation. But common areas, some businesses are closing them, and I'll give you examples as we go through. But businesses are taking actions to ensure employees do not congregate. And it goes so far as to, how do we handle taking employees' temperatures before they are allowed into the workplace? Step 4 of phase 1 is to minimize non-essential business travel. I don't know if you've been to the airport lately. I dropped my children off at the airport to go to Florida about a week ago, and there was nobody there. This is the Atlanta airport, and I talked to them when they got down to Southwest Florida, and what was the airport like there, and they said nobody was there. Plane that held 200 people, there was only 75. Now, this is one of the interesting things that we're hearing discussions on from many clients is they're finding that it may be just as effective to conduct business via teleconference and video conference and other things, and that way, rather than to having employees travel to a customer, for example. This could have a significant impact on travel industry, airlines, and things like that. Phase 1 of step 5 of phase 1 is to consider special accommodations for workers who are members of a vulnerable population. Now, let me just tell you, and I'll talk more about this as we go through. Be careful taking actions that could be discriminatory. Now, for example, let's say you got somebody that's 66 years old, and you assume that they're in a vulnerable population, and you treat them differently than someone, say, 20 years old or 30 years old. That could be a violation of the Age Discrimination in Employment Act if you're covered. Okay. Another example is, pregnant women. Pregnancy is a vulnerable consideration or category. If you treat a pregnant person differently, that could be a violation of Pregnancy Discrimination Act. So be careful there. There's also possible problems with the Americans with Disabilities Act, but unique in terms of almost every law now has a requirement of evaluating whether a reasonable accommodation can be made. And those can't be on a broad scale in most all cases. They have to be taken on a case-by-case basis. Now, phase 2, similar to phase 1, but within phase 2, the federal government says continue encouraging remote work and telework. And by the way, the different phases are being initiated or based on what's going on in the healthcare community, what kind of healthcare resources are available, and they being taxed, what is the rate of new cases, and it also is affected by the vaccine and medicines and things like that. Step 2 is continue to close common areas. And by the way, when I'm thinking about it, one of the common areas that we're talking to clients on, and it's an interesting situation, is bathrooms. We have clients, Paul, who have done, and we've worked with them. Matter of fact, I did one about 2 weeks ago where I walked through a plant where they're making what we call, from an OSHA standpoint, is engineering controls. And they're reconfiguring their bathrooms. And what they're doing is, instead of having a common bathroom with 4 or 5 stalls, they are brought in a contractor to have individual bathrooms. Sort of like what you see in the airports with family bathrooms and things like that. That's what they're doing. They've identified issues within their facility, and they are bringing contractors in to reconstruct them. Step 3 of phase 2 is business can resume non-essential business travel. Obviously, we're not there yet. Step 4 is to continue considering special accommodations. And they, throughout all of this, nearly all the government agencies and agencies like the CDC, quasi-government agencies, are encouraging remote work. And this is another thing that many employers are looking at is they're finding that remote work is, from a performance standpoint, from a business effectiveness, efficiency, getting things accomplished, are just as successful or just as good as having employees in the office. They don't need to have employees in the office. And think about the effect on travel time. Think about the quality of life from an employee standpoint. Think about the real estate industry. If companies don't need as large office footprints, as I mentioned earlier, that's going to have an effect on that. We've always had in our offices a hoteling suite, an office where lawyers come in from other offices. They can reserve an office and secretarial support and things like that. That may be more prevalent in the future. And the final phase 3, is really resume normal operations, resume unrestricted staffing, etc. Now let's start talking about some specifics here. A restart plan of action. Now, designate a COVID-19 response team. Now, I don't know. It depends. The response team makeup would depend on the size of your business and things like that. There's a lot of different things that could go into determining who makes up the response team. It could be just one person, for that matter. But this response team should be tasked with an evaluation of the facility. Okay, and I'll get that more detail in just a minute. But reimagine your processes. Think out of the box. How can we accomplish the things that we need to accomplish in a different way than we have in the past, which provides a safer, more effective solution? Look at your protocols, procedures, and policies, and I'll provide more information on that shortly. Evaluate local and state shutdown orders. Now, this is not a one-time situation. You need to continue monitoring what's going on locally and from a state perspective. So in that regard, look at things like what is the rate of new cases in your particular area. Get as much information as you can to determine how it impacts your workforce. Are these new cases basically in the vulnerable populations, such as retired individuals, or are they younger people that are the age of your workforce or have the characteristics of your workforce? Do you have a workforce, a lot of families, and there's been an uptick with children, which increases the possibility that your workers could catch the virus from their children? But with regard to the COVID response team or individual, take a walk around your facility. Note any CDC or OSHA compliance issues. Now, on our website, we have a list, sort of a checklist of the things that you need to look at. But the biggest thing is spatial distancing, things like that, social distancing. Look at it. What kind of common surfaces that need to be cleaned, sanitized, disinfected? Are there shared computer terminals, keyboards, things like that? But you create a list of action items and you take steps to resolve them. You should document this because, again, you could be subject to a lawsuit in the future. So you want to be able to show that you have acted in accordance with CDC, OSHA guidelines, other applicable guidelines. CDC and OSHA are the primary ones, to show that you acted as a reasonable employer under the circumstances. And that is limited to the extent by the fact of available information from the CDC and OSHA. But you need to document this because you don't know what's going to happen. There could be retaliation claims against you, either OSHA retaliation claims, or it could be something else related to retaliation under one of the alphabet soup laws, federal discrimination laws. Spatial distancing. It's easier said than done. You need to, again, walk around your facility listing the items, but you got to look at what practically takes place in your workplace. How do employees interact? You may need to adjust your office layout, okay? And I'm sure many of you have been to retail stores where they have one-way aisles and things like that. In our office in Atlanta, we have one-way designated with tape on the floors. We have tape on the floors which show lawyers how close they can get to their secretaries. We've erected barriers and things like that. Spatial distancing, which requires potentially elimination of any common areas, or some kind of administrative solution, rules that only allow a certain number of employees into the area. I've seen businesses, or working with businesses, that have taken every other chair out of the break room. We've had situations where employers have decided that only every other cubicle is going to be used. Think about an area where employees congregate, like a time clock. How are you going to deal with that? Not only do you have the spatial distancing, social distancing aspect of that, but you got the sanitation, disinfection aspect of that. So you need to have all these procedures, protocols in place. And I've already mentioned bathrooms, and I just touched on break rooms. But again, reimagine your processes. Think out of the box. What changes can we make that have a minimal impact on productivity, but provide a safer workplace for our employees? And also think about in terms of if you're a retail outlet, or you have customers coming to your place of business, like the Forsyth Chamber has been very innovative in how they deal with people that come to its offices. And for more information on that, Scott can provide it to you. But they essentially have an input area where an interested person that comes to the chamber can enter the information, their needs, and then they're addressed with minimizing the contact between that individual and a chamber employee. Now, protocols, procedures. Make cleaning wipes, sanitizers, gloves, and masks readily available. Think about setting up a sanitizer supply station. And in this regard, make sure employees know where it is, how to use it, one employee at a time. And by the way, when I'm thinking about it, when you bring employees back, you need to have a meeting with them. Now, the meeting doesn't need to be face-to-face in a conference room or something like that. You can do the meeting via teleconference, and you need to document it. Will you tell them what your rules are? You make sure your employees know what your rules are with regard to work at your location. Post signage reminding employees of sanitation safety standards, your rules. Again, evaluate local and state shutdown orders, and again, also monitor your local conditions and document your monitoring. You may assign someone who every day or once a week reviews the situation in for example, Forsyth County or wherever you might be located, to determine what's going on with the rates of infection. Okay. What is there a significant uptick that could cause you to go back to where you were before you restarted your business? I mean, that is a potential issue. One of the issues, and I think it's easing somewhat, is make sure that you have the supplies, goods, and materials necessary to operate. The sanitizing wipes and all that. If you're requiring personal protective equipment, PPE supplies, make sure that you have an adequate, sufficient amount of those. Make sure that you have evaluated your sanitation and disinfection protocols. And it varies depending on a number of things. And if you go to CDC's website, you'll see that non-porous surfaces, soft porous surfaces are treated different than hard surfaces and things like that. Originally, they said the virus could last 9 days. Now it's the latest I've seen is 2.5, and some of the information I've been seeing says that if it's because it's getting warmer, the heat destroys the virus. The virus can't survive the heat, but who knows? But in any case, you got to take the best available information and make sure that you're sanitizing and disinfecting work surfaces. Now you can go to the EPA's website. EPA's website has a list of those cleaning chemicals that are effective in killing COVID-19. So make sure that if you're using something, don't assume that's an effective in killing the virus. Go to EPA's website and see what the recommendation is. In this regard, you can go to the manufacturer's website, and that information is on many of those websites. And if it's, you may need to get a safety data sheet. And matter of fact, you should get a safety data sheet. You can download it from the manufacturer's website. But look at the safety data sheet and determine whether there's any effect that you may not have known about it on the employees who use it. There may be personal protective equipment that's required for the employees who use it. And there may be, as an effective substitute for that does not require the personal protective equipment. But you're responsible as an employer for doing that. Now, you need to review and revise your safety policies. You need to publicize those policies to your employees. You need to train your staff on the policies and what's necessary to comply with them. And that would be, where the supplies are, what the expectations are. Don't forget your managers and supervisors. They generally need more in-depth training with regard to your policies and procedures because they're charged with enforcing them. And you also need to take into consideration the fact of, okay, there's a violation. How is it going to be handled internally? Is someone not complying with the policy? What authority the managers and supervisors have? If it's something that's somewhat out of the ordinary, is there a communication channel available for to support the manager and supervisor in making the decision to avoid, say, a potential retaliation claim? Also, there's transportation issues. You have ride share, and it's not so much in Forsyth County or in Atlanta, for that matter. Generally speaking, our employees their transportation, their mode of transportation to and from work. Does that subject them to a higher risk of contracting the virus? But overall, you need to engage and encourage your employees. Make sure your employees are aware of what you're doing, what has been done, what the expectations are of them. Communicate with them. Talk to your supervisors, managers. Ask them what type of questions they're getting from their employees. What are the concerns? What are the considerations? You want to offer encouragement, but you need information because you may need to make adjustments to your policies and procedures. Now, there may be questions from employees about how their benefits are going to be handled. Well, I had vacation, and do I accrued vacation when I was on furlough? What other things are what is my status of my paid PTO, paid time off account? What about if they're terminated? Is there going to be a waiting period for health care? These are all questions that a manager or supervisor may not know. So the manager or supervisor needs to be told, you get questions that you can't answer. You need to go to the person who has that information so you can timely respond to the employee. If that employee is asking you a question, it is important to that employee, and you need to develop good or maintain good relations with your employee by getting them an answer. Okay, so keep that in mind. You want to establish clear channels of communication. Make sure that your different stakeholders are aware of what these channels are and how to use them. Make sure that they're effective. Now, you talk about open door policies and things like that. Well, I hear open door policies historically that, we got an open door policy. Well, you can have an open door policy, but if the employee does not feel comfortable, maybe going to the particular manager or supervisor because they just blow them off. And I'm sure you all know that managers and supervisors like that, and it may not be intentional. They may be busy on something that this is a deadline to finish or whatever. But think about including a bypass mechanism. If you don't get the answer that's satisfactory to a particular employee, the employee can go to another source, another manager, supervisor, or HR, or safety, or whoever, to ask the question. You need to document concerns raised and show how you are resolving those concerns. If an employee has a concern, other employees could have a concern. It may need that you need to evaluate, research it, decide how you're going to handle it, and then communicate with managers and supervisors because it could be a common question or common concern among employees. You need to communicate on a regular basis. Now, there's a lot of companies out there that use email and things like that, but they really have not, and the focus has been more on external communications. You need to figure out what's the best way to communicate with your employees, to address your questions, establish an internet site, intranet site that they can go to for information about what's going on. Particularly if someone tests positive for COVID-19, you need to notify employees. Do you have a resource or a manner or a process to notify your employees? Communicate with them or over-communicate with them because they all have concerns. And there's so much misinformation out there. But you can provide information to employees via email, social media, text messaging. You can give it to them hard copy. You may use all the different vehicles to communicate with your employees. But I can't overstate the necessity for good communications with your staff. Solicit feedback from your employees. How are we doing? Do you have some concerns, which I've already mentioned? Do you not understand why we're requiring this particular procedure? Communicate with your employees. Look at resource sites, see what your other companies in the industry are doing. Look at, go to the chamber. Ask questions of the chamber staff because they may be able to provide you information that you didn't, a way to handle something that you hadn't thought about. But the chamber is a good resource in this regard. Some employers are implementing employee engagement surveys, specifically asking questions on subjects to get feedback from employees so that they can improve. Okay, I've seen one recently that used a SurveyMonkey to do that. You can use skip level meetings. Now, some of you might not know what that means, but you as, for example, an HR manager or COO or CEO or CFO, go to the employees directly without the managers present. Now, some supervisors, managers don't like this, but what it does is you're getting input directly from the employees and it's not being filtered by managers or supervisors. Now, returning employees to work. If possible, as I said at the outset, return employees in phases. Look at your policies and procedures. And some of these policies, for example, your leave policy. That's leave of absence, PTO, vacation, personal time off. Look at your remote work policy. And I'll touch more about this in depth in just a second. Look at your sick time, paid time off, your timekeeping procedures. Okay? If they're non-exempt employees, you're required under the Fair Labor Standards Act to keep an accurate record of the hours they work. Well, if they work remotely, how are you going to handle this? How are you going to make sure that the employees are accurately recording their time? With regard to bringing employees back to work, say that you bring them back you stagger the work schedule, the start times, so that you don't have congestion at the time clock, or you don't have a bunch of employees trying to get through the front door or the employee entrance at the same time. It's very important, depending on the size of your workforce, if you're taking their temperatures. You don't want a significant number of employees standing in line waiting to get their temperatures taken. There's wage hour considerations in that regard, but you need to think about these things to avoid the possibility of exposure to employees to the virus as a result of policies, procedures, protocols that you've instituted. You want to look at your information technology and usage. Again, and this gets back to remote work, but you think in terms of what actions are you taking to protect your proprietary confidential information, trade secrets. You may not have sufficient security. You may have, especially if you have information that you're required under the law to take data security measures, such as customers' credit card numbers, other personal information about customers, and also personal information about your employees. What steps are you taking to protect that information from malware or someone stealing it? Because that's a whole new ball game at data privacy that to the extent possible you want to avoid. Now, I just tell you, some businesses are setting up walls. I guess you call them a firewall, which denies access remotely to this information except to specific people who absolutely need it to conduct business, so that someone accessing your general communication systems cannot get into that server, for example. Look at your travel policies. Think about how you're going to handle travel going forward. Drive, air travel. Most companies right now are requiring an employee to get approval prior to traveling somewhere. Now, it's not only your procedure, but in that case, you need to look at what is the process, what are the protocols for the company where the employee is intending to travel. So look at that. You have to take those all into consideration. Also, it's a good idea to put on your website for visitors, which most companies are not allowing. They're not allowing sales calls. They're not allowing anyone into the workplace to minimize exposure to their staff to the virus without prior approval. No walk-ups, things like that. But in that regard, publicize it so there's those people, those stakeholders, so to speak, or interested parties, have the information so they know what your process is, what your procedures are, so that you don't have to deal with that problem. Now, considerations on who to bring back to work. Consider which employees are needed. Again, look at phases. There may be some employees you need to bring in before you bring other employees in. Again, consider remote work. Now, I don't know if anybody here is familiar with the various types of discrimination claims. There's disparate treatment, which is more like a direct discrimination. You took a specific action because of my age, for example. But there's also a disparate impact analysis. It can be sort of an unintended consequence of a policy or procedure. Your decision with regard to, for example, of who you bring back could have a more negative impact on people over 65 years of age, which is a potential violation of the Age Discrimination Employment Act, or pregnancy, which I talked about earlier. Do you have a policy in place? It's not directed at any particular individual, but when you look at it at the end of the day, it had a disparate impact on a particular protected category. Now, the way that it's proved by plaintiffs is they do a statistical analysis. But what I've been doing is with clients, just finished up one yesterday, is we looked at a snapshot before and after. And we're looking at before and after, what was the various percentages of different groups of employees before, and now that you brought them back. You need to look at that, okay? Because you need to make sure that, hey, this policy that we've instituted, we've made some tweaks to it because of this potential impact on a protected category. Take into consideration when you're looking at bringing employees back with regard to known health conditions. Now, many employers don't know what health conditions are for employees, but they don't want that information. It really doesn't have it never had a direct impact on their performing their jobs. But think in terms of if there's known, what kind of reasonable accommodations can you make? Don't just exclude some employee without doing that analysis. For example, I had one not too long ago, I guess it's been about 2 weeks now, where the individual had one lung, and the employer knew about it. And so what we did is, it was an engineer. They preferred to have the individual back because of specific job requirements, back at work, rather than working remotely. And what we did is we engaged in the interactive process with the employee and the employee's healthcare provider. And we discussed various things that the company could do as far as reasonable accommodations so that the employee could safely return to work, minimize the risk of exposure. Now, it was interesting, but what we found at the end of the day, because this employee was in his mid-20s, and nobody at the time knew that the employee only had one lung. They'd never seen anything like that. But what we came up with at the end of the day was there was no accommodation that could be made. So their accommodation, no accommodation could be made, nothing the company could do to return that employee to the office. But what we ended up doing is making a reasonable accommodation so that the individual could work remotely with near the same effectiveness. We looked at technology, we looked at things like that. Now, some of the employees, co-workers complained about this. They wanted to work remotely. Why can't I work remotely when this employee is being allowed to work remotely? Well, this is a reasonable accommodation, and these individuals weren't eligible because of their situation to this type of reasonable accommodation. But they just had to live with it, and we had to deal with it and explain to these other employees that, hey, look, you're not subject to this situation. But the company looked at the specific situation, made an individual assessment, engaged in the interactive process, and what we ended up doing at the end of the day is relying on information provided by a third party, someone who is qualified to make the recommendation. Now, if you get sued later, you just point the finger at the third party. All we did was do what this third party professional with expertise in this area told us to do. And based on that, this is what we did. So you can minimize the threat to litigation in that regard. Let's say you got employees who don't want to return to work. Now, this is a big issue, and it goes back to the fact that in many cases, employees are making more on unemployment, and that $600 federal supplement, weekly supplement, is a big reason. But last time I looked, employees working or on unemployment are generally making about $24 an hour. Well, that's a huge situation for, if you got an employee that's working, making 10, 12, 18 bucks an hour, they can stay home and make $24 an hour. And it was extended and unemployment benefits were extended from 26 weeks to 39 weeks. I mean, it is you think about it, employees, certain categories of employees, based on purely on wages, earnings, can make more on unemployment. Now, you want to bring employees back in many cases because you need to look at your equivalent employee, FET count, for loan forgiveness and things along those lines. So what you want to do is contact employee, tell them that you want them returned to work, make a written offer to rehire. Okay? Document the employee's response. If the employee says, no, I'm not coming back to work, then you've got to notify the various departments of labor that, hey, look, we've offered this employee to return to work and he's refusing to return to work. The employee is generally speaking no longer eligible for benefits. If the employee receives benefits, which could happen because of the volume of unemployment claims that are being handled, that could be fraud. It could be subject the employee to criminal sanctions. Okay, now you don't want to threaten the employee with criminal sanctions, but you can say, hey, look, you're returned to work, you document it, you make the report. Typically, it's about you have to make the report within 20 days. Now, keep in mind that you may bring back an employee at reduced wages. There is the possibility that the employee could still be eligible for partial unemployment benefits. So you look into that, assist employees in that regard. You may have additional reporting requirements. You do in Georgia. In that regard, an employee may be making, say, for example, $15 an hour for you, but because of reduced wages based on your particular conditions, he may still be eligible for unemployment compensation benefits, partial unemployment compensation benefits. Don't threaten your employees. Just document it and then do what you have to do. Now, again, for loan forgiveness, many companies are calling us, clients are calling, saying, hey, look, what the heck am I supposed to do? Well, try to hire somebody else to replace the employee, document it, but there is no, with regard to loan forgiveness, there is no offset, so to speak, if you've offered an employee doesn't, says I'm not returning to work. Your responsibility is to put somebody back to work, okay? Now, I've already mentioned reasonable accommodation, interactive process. That is very important. Just don't make a decision unless it's something relatively simple that you can do. You may need to contact the employee. Well, you're going to contact the employee anyway and talk to them about what type of accommodations are available, what you can do. In most cases, the employee will agree without any problems. But there is no. You have to look at each case on a case-by-case basis. One size doesn't necessarily fit all. I mentioned imminent danger here. That you may have employees that refuse to work because they're saying, I'm concerned about the safety, contracting the virus. As I mentioned earlier, you want to take the actions after evaluating your workplace that minimize the employee exposure. You need to communicate that to employees. This is one of the reasons. Now, imminent danger, that is a pretty high standard, and it's a terminology that you hear in relation to OSHA claims. The imminent danger has to be, and I guess imminent would be immediate is a better word to use. It has to be the immediate threat of death or significant illness. In most cases, that, with regard to COVID-19, in the non-critical business or non-healthcare businesses, is not, you can't meet that standard. But you want to listen to what the employee has to say and then deal with the specific employee's concerns. So keep that in mind. Now, remote work rules. Some companies have instituted remote work rules subsequent to the COVID-19. Some have been in place. Some have revised their remote work rules. But you need to look at, number one, your technology. Look at your systems, software, and I mentioned earlier, data protection, look for cyber threats. But look at, you can provide the employee laptops. How are you going to handle this? What type of access are they going to be provided? Look at your work processes. What are the work schedules for your employees? When are they supposed to be available? Think in terms of OSHA compliance, workers' comp issues. You got an employee that's working at home. It's not like working in the office where you have engaged in actions to minimize hazards to the employee. You may have a situation with employees working from home in an area that has hazards, high risk. So, have an agreement, written agreement for remote work where you deal with these issues. Is a possibility that an employee could get hurt at home, and it could be an OSHA investigation of it, and they could hold you responsible for not providing the employee a safe workplace. You also have workers' comp considerations. Was the employee performing work at the time they were injured? Now, I'm not talking about COVID-19 here. It may be a slip and fall type situation, a back injury or something like that. So you need to take a good remote work agreement will deal with these things. I've had situations arise where an employee was working in the kitchen making dinner, cut their hand, and then made a claim under workers' comp. Well, that had nothing to do with work, but in some cases there's no policy or procedure. It's not mentioned, so it becomes a gray area, and then the problems have to be dealt with. But think in terms of a written policy, documenting what the requirements are from a perspective of notifying the employees what the expectations are, but also protecting your interests. Now, best practice for returning employees. You have furloughed employees and you have employees on short-term layoffs. Now, we're dealing with a lot of companies that have employees that were furloughed or on a short-term basis, short-term layoff. They're bringing them back to work because it's only been, in many cases, only about 60 days. The question is, from HR professionals, is do they have to go through the normal hiring process? Generally speaking, no. Okay. But you need to look at, and I mentioned this earlier, look at your benefit plans. You need to look at your policies and procedures. How does it affect the employee's eligibility for your benefits? How does it affect employees' the options with regard to benefit programs, vacation? Did they accrue vacation time while laid off, etc., or on furlough? Think also in terms of if you terminated employees and you're bringing them back. Now it's on a short-term basis. Do you treat the terminated employees like they were on a short-term layoff? Well, if they're terminated, it's potentially a little bit different situation. You may require the employees to go through the full hiring process like you normally would. Some companies are doing that. It's a short term, so you're not really concerned about employee working someplace else. Likelihood of criminal activity is minimal. So do you need to run again the criminal background check, things like that? But it is, generally speaking, if you terminate the employees, it might be in your best interest to put them through the full hiring process again. Now, with regard to I-9s, essentially I-9s are good for 3 years, so it's not an I-9 issue in many cases. I'm getting that question frequently. Do I have to have an employee complete the I-9? I have companies that, because of the short-term nature, and they were terminated, they're bringing back employees, having a meeting with them, in most cases via teleconference, telling them what their rules are, and then having them sign an acknowledgement form that they are acknowledging they're still employed at will, that they are still covered by the policies and procedures that were in place that they signed previously, things along those lines. Now, some companies have key policies, such as the protection of confidential information, non-competition, arbitration agreements, that they are requiring employees to re-execute because of the legal significance, the potential that an opposition attorney would contend that they were not legally enforceable against their client because of the severance in employment. So think about in those terms. Now, handbook acknowledgments, they're having them re-sign handbook acknowledgments in many cases, but they're not going through the full-blown process. But again, the best practice in many cases is to treat them like new employees and go through the process as you would a new hire. With regard to your policies and procedures, we're getting a lot of questions about, do we need to redo our employee handbook? Maybe, maybe not. In most cases, companies don't know what the long-term impact on their policies and procedures are going to be. So they are issuing policies and procedures that are not permanent, so to speak, and they're not revising their employee handbooks, and they're waiting to do so to get a better handle on what is going to happen and what is going to be the impact long term on the business before making changes to their employee handbooks. The discrimination policies, things like that, still apply. But as far as changes with benefits, remote work, things like that, we don't know what the long-term impact of COVID-19 is going to be. So they're holding back. But they are informing employees and having them sign acknowledgement forms with regard to the policies, procedures, and related protocols, etc. They're signing acknowledgement forms after making sure that the employees are aware of them. Now, wage and hour compliance. Pay adjustments. If you're making pay adjustments, look at the loan forgiveness. If it's more than 25%, it could affect your loan forgiveness under the payroll protection program. So look at that. Bonuses could have an impact. Bonuses for non-exempt employees may have an impact on the regular rate of pay, the calculation of the regular rate of pay. And there's issues associated with that, is over what period of time does this bonus cover? You know, we're returning this employee to work. We're incentivizing the employee's return by giving them a bonus. Well, if it's a non-exempt employee, it could have an impact and need to be taken into consideration. In many cases, it's not going to be considered a discretionary bonus. Discretionary bonuses do not have to be taken into consideration with regard to regular rate of pay calculation and the period of time. A bonus could increase the regular rate of pay, and it could impact if an employee worked more than 40 hours in a work week. You could owe an employee additional money in the form of overtime. So think about it in those terms. Now, with regard to bonuses for exempt employees, you don't have the same impact that you have on non-exempt employees, but think in terms of, does this affect other benefit programs that we have? For example, does it affect 401k? How's it going, your 401k program or other benefit programs in that regard? Does what are tax issues? What what are the effects? You need to review your programs, your benefit plans in that regard. You can change someone's duties and when you bring them back, and that duties the new duties may make that employee non-exempt. Okay, so think in terms of, hey, these new duties, is this employee still exempt? I've run into a number of situations where the employee prior to COVID-19 was a supervisor, supervised 2 or more employees who was covered by the executive exemption. Well, they're bringing them back, and for a period of time, that individual is not going to supervise but one individual. He no longer qualifies for the executive exemption. Now, it's not only a duties test, there's a salary basis test. An exempt employee has to be paid, as of January 1, $684 or more each work week. Well, some of exempt employees are being brought back at less than that. So they're no longer qualify for being exempt. So think about that. With regard to remote work, I mentioned that you got to take into consideration how are you going to track, make an accurate record of the hours worked by the employee. It's difficult. They're working remotely. How do you know when they work or not work? They're answering emails in the middle of the night. You need to have a policy, a timekeeping policy that employees that sets forth what employees are required to do with regard to their recording their hours work. And it's a good practice for each work week, have the employee review their time records and initial them so that they are certifying that they are an accurate record, to avoid a potential lawsuit under the Fair Labor Standards Act. I've already mentioned salary-related issues with regard to exempt employees, but take that into consideration. Now, some companies have converted exempt employees to non-exempt employees. There's nothing wrong with that, but be careful when you treat them. You reclassify them as exempt from non-exempt. If you do that with frequency, say every couple pay periods you're making a change, that can cause potential legal issues or an investigation by the Department of Labor Wage Hour Division. They don't like that. Okay, employee retention. Talked about this earlier, but review your plans, communicate with your employees, evaluate child care issues, have a system in place to identify problems, solve the problems, and worksite safety is not a one-time situation. You need to continually evaluate what is really going on in your worksite and whether any changes are necessary to provide the employees a safe workplace. Common regulations that are having an impact. I mentioned earlier sanitation, disinfection. You may need to have a written hazard communication program pursuant to OSHA requirements if you're having employees or your cleaning staff use chemicals that are not generally used in the household, etc. You may be required to have safety data sheets and put them in a binder or in some manner make them available to employees. So be aware of this requirement and be prepared that you may have to have a written hazard or HAZCOM policy. So you also got to take into consideration personal protective equipment. With regard to personal protective equipment, you have to do a job hazard assessment. You got to look at, with regard to PPE, and PPE can include masks, and I'll touch on that in just a second in more detail. But, does the mask effectively deal with the hazard? And there's different types of masks that have different implications, further implications under OSHA. Does it create an additional hazard to the employee? Let's say, for example, you're requiring employees to wear surgical masks, or you're allowing them to wear surgical masks or these homemade cloth masks. Does that create an additional hazard for the employee? Now, in that regard, let's say that you got an employee that's operating a piece of equipment, and that mask could get caught in the equipment and subject the employee to injury. Well, that needs to be taken into consideration. With regard to PPE, you need to have the policy, and you need to also train employees on the care for their PPEs, how to clean the PPE. And when I say how to care for it, what I'm talking about there is how does the employee recognize that this particular device needs to be replaced? It's no longer effective. Now, even if there isn't a particular OSHA standard that applies, OSHA can still cite an employer under the general duty clause. And that's because employers have a legal requirement, a legal duty to provide a workplace that is safe and free of health and other safety hazards to the employees. Refusing to work, I talked about the imminent danger situation earlier. That is an OSHA concern, so it can be a whistleblower type situation and things like that. With regard to record keeping, OSHA has changed the position on that, and you weren't required initially to record COVID-19 cases. Now you are. In some cases, if it's work related, and I'll touch more on that in just a second. Now, all businesses have a OSHA reporting requirement. If you have an employee that's dies, and it may be dies as a result of COVID-19. You could have a requirement to make a report to OSHA within 8 hours. If you have an individual who is hospitalized and it's because of COVID-19, you could have a requirement to report that to OSHA within 24 hours. If that situation arises, give me a call and I'll tell you specifically what you need to do. Make sure that you have to report, because one of the problems that arises for employers is investigations by OSHA, inspections by OSHA that were triggered by a report that the employer was not required to make. Now, with regard to taking temperatures, some state and local orders are requiring employers to take the employee's temperature. This is more likely in critical businesses, healthcare industries, things like that, healthcare related entities, things like that. But if you're taking temperatures of employees, you need to have procedures and protocols in place to protect the employees who are taking the temperatures. Now, it's going to depend on the type of equipment you're using to take temperatures and things like that. But PPE, barriers, face guards, and things like that may be necessary. Now, I have a number of clients who have decided that they're not going to expose their own employees to the health hazards when taking temperatures of their coworkers. So they are contracted out to a third party, and that third party is taking the temperatures. And then if someone has a temperature above 100.4, then they're taking action or whatever. That 100.4 is what CDC says is the limit. But think in terms of the fact that there are a lot of asymptomatic cases. So you may have employees that have COVID-19 that do not have a high temperature, 100.4 or above. They're not exhibiting any of the symptoms. So it is an effective in many regards, but it's not absolute, taking employees' temperatures. I saw recently something on the CDC's website, I believe is where I saw it, that said that taking temperatures is about 88% effective in identifying cases. Well, that's a pretty high number, but you got to remember that it's not it doesn't provide absolute certainty. You got to look at other things such as you got to require employees to communicate exposure. If they got a family member that has been tested positive or has been exposed, there'll be situations and actions you have to take in that regard. Now, with regard to face masks, this is an interesting situation. Think in terms of there's really three types of face masks. There's the first type, which is classified as a respirator. It is an air filtering device, and it includes N95 rated face masks. If you have a respirator and you're requiring employees to wear them, you have to satisfy OSHA's respiratory protection standards, which require such things as a hazard assessment, a fit testing, a medical evaluation, whether the employee can wear the device without affecting or creating a greater hazard to the employee. You got training, care, you got to provide it at no cost to the employee. Now that you got the next level, which are like it's non-filtering because it's loose fitting. For example, surgical masks. Surgical masks are not covered by OSHA's respiratory protection standard, but if you're requiring employees to wear surgical masks or some kind of cloth mask, something that doesn't rise to the level of a respirator, you're required to comply with OSHA's personal protective equipment standards. And as I already mentioned, you do the hazard assessment, etc., to evaluate whether it's effective and doesn't create greater hazards to the employee. Now, if you are requiring employees or allowing employees to voluntarily wear face masks, you got to look at what hazardous condition are the face masks being used to fill forward. Make sure that the face masks don't create a greater hazard. and ensure that the masks are kept clean and in good condition. Provide employees some minimal training in that regard. And then you have to have them sign to acknowledging that you provided them the required information on Appendix D in the OSHA standards. Now, if you need information on that, let me know and I can provide it to you. But be careful, there's differences here. Now, there's also, if you look at CDC's websites, there's coverage or discussion with regard to homemade masks. Cloth masks, and they give the different ways to make them, etc., are not covered by OSHA standards, are not covered, generally speaking, from the OSHA's PPE standards. They're homemade, so if employee wants to wear them, they can wear them. OSHA has said that they don't rise to the level to require these other requirements. So be aware of these different sort of topics or types of face mask and the requirements associated with them. If you're requiring employees to wear face masks, the respiratory protection standard or the PPE requirements under OSHA, you have to pay for it. You have to provide it to the employees. If they're voluntary use of it, there's other requirements that must be met. Now, I don't know if any of you all have unions, but if you have a union coverage for your employees, you got to look at your collective bargaining agreement. There may be other requirements that need to be met prior to instituting any of these requirements. But generally speaking, look at OSHA's requirements, look at CDC's recommendations in making a determination with regard to face masks. And by the way, if you go to CDC's website, it really does not encourage employers to require employees to use N95 face masks. And they do not want a run on those face masks. And I think this was one of the reasons that you initially heard a lot of discussion about it. It was not effective and things like that, because they didn't want to run. They want to make sure they're available for the employees in healthcare environments and things like that that actually have a greater need and actually need them. But take that into consideration. May be difficult to get supplies of them, etc. But if you look at CDC's recommendations, it's good. They are effective to some regard or to some amount in minimizing the transmission from the employee to other employees. It doesn't necessarily protect an employee from exposure who's from another employee. So take all those things into consideration. Now, social distancing, I've already talked about this. Treat every area in your business like it's an assembly warehouse. All your work processes have different stages. Stage 1 is issuing a PO, purchase order. Stage 2 is taking it to accounts payable or something along those lines, or accounts receivable. There's stages in this. Evaluate your common routine, break it down into the different components, and then make a decision on how we deal with social or spatial distancing. And before let me talk about this. With regard to actions that you take from an OSHA standpoint, OSHA has three levels of actions that an employer can take to provide a safe work environment. The most desirable is an engineering solution, and that would be, for example, barriers. In comparison to requiring employees to wear face masks, a barrier is more effective, and it doesn't have the hazards associated with potential hazards associated with requiring employees to wear face masks. The barrier can be plexiglass, and you're seeing them in retail outlets and everything like that, but you can put up barriers. We've done it in our offices, have extended cubicles so that 4 feet above that is a barrier in addition above the normal cubicles. so that it has a greater impact on decreasing the transmission of the virus. The next level that OSHA looks at is administrative controls. Those are work rules, etc. The last level from OSHA's standpoint is personal protective equipment. So when you're evaluating an effective means to minimize transmission in your workplace, think in terms first of engineering solutions, then administrative rules, and then personal protective equipment. Now, don't be surprised that your solution or your final decision is a combination of the three, but be open to those things. Now, what about handling confirmed cases when your business reopens? CDC's guidance has a 4-step plan. And this is important because at this point in time, there's no vaccine, there's no treatment, although there's some things that are going on that appear to be very encouraging. But step 1, isolate, quarantine the confirmed employee. The infected employee should be sent home until released by a healthcare provider or a public health department. You send the employee home. And the best practice is, not just for 14 days. If they have COVID-19, you need to have some kind of documentation saying that they're safe to return to work. Before the infected employee departs, they need to identify the individuals who they worked with in close proximity. That's for a prolonged period of time. That's more than just a few minutes. But these potentially exposed employees, these individuals have worked in close proximity during the previous 14 days, they potentially need to be sent home. Okay? Now, that's why it's important to, social distancing, doing everything possible to limit contact with employees so you don't get in a situation where you could have one employee who is a confirmed case who had contact with a significant number of employees, which the end result is shutting down your business. Okay, so be aware of that. Step 2 is to address employees who worked in close proximity to the infected employee. Again, send them home for a period of 14 days. Now, let me just tell you something interesting that's come up several times here. We've had situations where employees who were confirmed cases, who within a minimum number of days, and then the most recently within 5 days, brought a doctor's note, said that it was safe for them to return to work. Now we have employees that, unconfirmed cases, employees that worked in close proximity that had to be sent home for 14 days. So you have situations where confirmed cases with the doctor's orders have been excluded from the workplace for a shorter period of time than unconfirmed cases or employees that may have had contact with someone that had COVID-19, may have been exposed to it, but they're not confirmed. So think in those terms. Then there's a distinction with the CDC as to non-critical businesses and critical businesses. Now, with a critical business, you have workers that worked in close proximity. You have options. Option 1 is to send the employee home for 14 days, as I just discussed. Option 2 is to allow employees to continue working by following the CDC guidance. Now, CDC's guidance specifically address this, okay? You must check the employee's temperature before they start work. Employees must self-monitor their symptoms. And questionnaire is often used, asking the employees about their symptoms. But remember, many cases are asymptomatic, which causes great problems. You must wear a mask for 14 days. Now, the purpose of this mask is to minimize the transmission from the employee to other employees. So a surgical mask, a cloth mask, in comparison to a N95 mask, may be useful. You must practice social distancing, and you must look at routine disinfecting and cleaning of offices, bathrooms, and common areas. There is the URL for the CDC with regard to guidance in this regard. To clean and disinfect, you must look at surfaces. Look at, again, when you do your evaluation, look at the surfaces. We got to clean them. We got to disinfect them. Keep a record of what's being cleaned, when it was cleaned, so that you got the documentation to show that you are acting reasonably. EPA registered, as I already mentioned, household disinfectants. Look at that. Alcohol solutions with at least 70% alcohol, or the CDC says it's effective. Diluted household bleach, CDC says it's effective. But look at the EPA's website for additional information. Now, I already mentioned about the hazard communications and wearing masks, but look at the safety data sheet to ensure that you're doing everything that's required pursuant to the manufacturer as it relates to the use of that chemical. The hazard communication standard, I've already touched on this. I won't get into it again, but again, you may be required to have a written hazard communication program, and you could be required to make sure that you reviewed and make available to employees the safety data sheets. Now, the fourth step is to notify employees. If there is a situation with positive tests for COVID-19, you need to notify your affected employees. Now, some employers are able to do it, or limited to doing it in person with email, etc. Some are using text messages and things like that. But you want to notify the employees that they've been potentially in contact with someone who could have COVID-19, but you do not want to give personal information with regard to the employee who could have exposed them. That raises privacy issues and things like that. Now, the reality is that most employees are going to figure out who it is, but you got to make sure your supervisors know that they don't give out the employee's name. They just said, hey, look, there's a potential you've been exposed. And inform employees about what you're doing to deal with the situation. And in most situations is sanitation, cleaning efforts, etc. Remind them to the employees who were potentially exposed to seek medical treatment if they exhibit symptoms, and things along those lines. Okay. Now, if you got a suspected but unconfirmed case, I've already talked about this. You got the same requirements. Essentially, it can be more problematic, and an unconfirmed case could require you to keep that particular employer or employees out of workplace longer than somebody's that has a confirmed case that is able to return to work earlier because of a doctor's note. With regard to OSHA and employees simply refusing to work, I've already talked about this as to imminent danger. There are 4 categories here, and I won't spend time because we're going kind of long here, but you see these 4 points here. This is the test that the employee has to meet. It's also the employer has to meet, that OSHA is going to look at if they're going to evaluate or conduct an investigation of whether there was imminent danger. So you can look at this and determine to make sure that you're in full compliance to minimize OSHA risk. Now, latest OSHA guidance, stay up to date on that. And with regard to recording, again, OSHA has changed their position. You must record a case, a confirmed COVID-19 case that is work-related, that results in death, days away from work, restricted work, or medical treatment beyond first aid. The issue that we're getting here is with regard to the question of work-relatedness. Now, with regard to work-relatedness, OSHA has set up a safe harbor. And this safe harbor, there's several different points. Did the employee ask the employee how he or she thinks contracted the virus? Did the employer discuss the employee's non-work activities? Because that's where the employee could have contracted it. The employer review the employee's work environment for potential virus exposure. If you have a work environment that limits contact between employees to less than 6 feet, it's unlikely that it's work-related, okay? What evidence was available to the employer at the time? It made its work-related determination. Now, That could be things like what's the exposure in the local community, etc. Again, the likelihood based on your processes, procedures, protocols is that the employee was not exposed at work. Did the employee's job duties include regular close exposure to people, to the public, general public? If that's the case, then it's more likely, it's a greater possibility that it's work related. Now, if you made a good faith attempt to determine work relatedness, and this is the safe harbor, but can't determine that it was more likely than not that the workplace played a role, then there's no recording requirement. You're not recorded to report it on the OSHA 300 log. So that's the recording. I've already talked about the reporting issue. Okay, OSHA claims. Now, it's interesting, OSHA is not conducting on-site investigations in most situations. They're using the rapid response inquiry, rapid response investigation. They're requiring the employer to respond to questions in a letter, for example. Be careful with that, because you could make an admission against interest that establishes a violation of OSHA standards. We have many clients. I had a client earlier today that contacted me right before I got on this webinar as to he just received a letter from OSHA, a rapid response inquiry, and we discussed how to respond to it. And he made some assumptions with regard to responding to it that would have created potential legal risk for him, for his company. So they're conducting remote inspections. They're doing it via like FaceTime, for example. Video, take photos, videos of the workplace, submit them to OSHA. They're doing remote interviews. Now it's interesting. Complaints are being initiated not just by employees. OSHA is receiving complaints by family members, members of the general public that are initiating inspections or investigations by OSHA. Now, keep in mind that there are retaliation possibilities under OSHA that you need to be concerned with, and as a whistleblower claims. Safety complaints by an employer protected. You can't terminate an employee because they made a complaint. And then you got the workers' comp situation in some areas of the country, some states. Haven't seen in OSHA yet where they're changing the burden of proof, where the employee, instead of having to show that they had the workplace, what caused the injury, the exposure in the workplace, unintentional exposure, created the workers' comp issue, the claim. We are seeing in some states, instead of employees filing workers' comp claims, they're filing personal injury claims. And they're alleging that the employer was negligent or intentionally exposed him or her to the virus. That's why, again, as I mentioned earlier, you need to document that you are taking the actions necessary to show that you've acted as a reasonable employer in the circumstances. Now, generally speaking, if it's a work-related injury, it's covered by workers' comp. But we have seen situations where workers' comp insurers are saying, no, you didn't contract it at work, you contracted it someplace else. So, you got to expect denials by insurers and be prepared to deal with them. Liability claims, I just talked about this. You could be sued by an employee or the member of the general public for negligence, okay? Or intentional gross negligence or intentional conduct. And the reason they're doing it is because workers' comp claims have a cap on damages. They're statutorily set. Personal injury claims, the cap on damages is essentially infinity. So it's greater exposure, greater chance of reward for the employer, non-employee from a personal injury case. Okay? The WARN Act, I'm not going to get into that, but you need to be aware that depending on your size and what actually takes place in the workplace, you could have requirements under the WARN Act that you have to follow to avoid potential problems. Okay? Now, I'm going to go ahead and wrap up here. But here is a list, and this webinar is posted on OSHA's, on the Chamber's website. Here's some useful links that could help you if you have certain questions. The EEOC's pandemic links, what you should know about COVID-19, and things like that on the EEOC's websites. You got OSHA guidance, so you've got the link to go to OSHA's guidance. Here's the link to go to the CDC for coronavirus information. And you got the World Health Organization. You need to look at all these sites. It doesn't take long to review them and determine, what you can do, look for advice, and what's the best practices and things like that. But again, you got to be a reasonable employer, document what you're doing, show a reasonable basis for the actions that you're taking, etc. And then, as I mentioned, our website has a number of specific areas, the frequently asked questions and then alerts that deal with specific questions and issues that we are finding from employers. Now, there's some information that wouldn't be applicable to you if you're a Georgia employer because they cover things going on in other states. But, you may want to look at the other information from other states because they may deal with a situation that you're confronted with, and it'll give you some kind of idea of the best practices and the best way to proceed. And you can also subscribe to our alert system. You can go on our website and do it. This is not for marketing purposes. This just provides you with direct link. And we email you or the information on alerts and things like that. We have a group of attorneys who that's all they're doing is keeping up with the different developments with COVID-19, and we are trying to provide information to our clients as quickly as possible, but no more than 24 hours. But any questions? I know I covered a lot of material. And again, if you don't feel comfortable in asking the questions here, you can send me an email. I'll get back to you as quickly as possible. The only time I really don't respond to emails is when I'm driving. I try to be safe in that regard. But Scott, I'll turn it back over to you.
Well, thank you, Tracy. Since we have less than 12 people, if anybody wants to click their mic and their video on, you're more than welcome to come in and ask Tracy a question. If we don't get one in a couple of minutes, then we will just sign off. We are recording this, and we will do a little editing on it this afternoon, make it a little bit more easier to download, but we'll put it on our website. And thank you, Tracy, for the plug for the Chamber. We do have a lot of resources out there. Those are on our website. It's togetherforfoco.com. It's together, the letter 4, FOCO, FOCO.com.
Okay, well, thank you very much for attending today. I appreciate it, and wish everybody the best of luck, and be safe in this situation. It's a changing environment. If you have any questions, please don't hesitate to contact me. I've always been a proponent of the Chamber and assisting Chamber members and things like that. So, don't hesitate. The Chamber's there as a resource. I'll be glad to help you. If I don't have an answer, we'll get you an answer if there is one. There's a lot of situations out there that we're getting requests or questions from employers, and there's no advice from the Small Business Administration. There's no advice from the CDC. There's no advice from the Department of Labor or OSHA on the specifics. So it can make it a very difficult situation for employers to handle situations with an absolute degree of certainty.
All right. Well, I guess that's it. Thank you very much, Tracy. Great information as always. And thank you everyone for participating in our webinar here. We will post this on our website in just a little while.